In this video, we will discuss the cortical spoking cataract, sometimes abbreviated as CSC. We will begin with a bit of background information, discuss how they're formed, talk about risk factors, and then conclude with the clinical presentation, evaluation, and grading of cortical spoking cataracts. So recall that the lens has three main components. There is the outer capsule, there is the inner nucleus, and then in between is the cortex. Now, it turns out that cataracts can form in different areas of the lens. So, nuclear sclerotic cataracts, of course, develop in the nucleus, whereas cortical spoking and posterior subcapsular cataracts both develop in the cortex. And for the purposes of this video, we will be covering the cortical spoking cataract. So cortical spoking cataracts are usually bilateral, but they're often asymmetric. They typically begin as these white, opaque, wedge-shaped tendrils that start on the periphery of the lens, often initially in the inferonasal quadrant. These tendrils represent local swelling and disruption of lens fiber cells. Now, over time, these tendrils work their way towards the center of the lens, much like spokes on a wheel, where they can be increasingly disruptive to vision. Now, as a review, recall that lens fiber cells form the bulk of the lens. So cortical spoking cataracts form over time as lens fiber cells become disrupted. This causes the membrane integrity of the cells to be disrupted, leading to loss of essential metabolites. And eventually, proteins become oxidized and are precipitated, and this is what leads to the cataract. There are many risk factors for cortical spoking cataracts, including age, which increases the risk for developing any type of cataract. Other factors that have been associated with increased risk for cortical spoking cataracts include exposure to UV radiation, diabetes, history of eye trauma, as well as myopia. So two of the most common symptoms that patients with cortical spoking cataracts report are glare and halos, and these lead to difficulty with driving at night. Now, of course, cataracts will lead to blurred vision or blurry lines in the visual field. So here are some examples of what CSCs might look like on anterior slit lamp exam. So here on the left you can see these white wedge-shaped tendrils that begin on the periphery and over time can grow centrally. And on the right is a cross section, so here is the cornea, here is the aqueous humor in black, and then here is the anterior surface of the lens. And we can see here that there's this tendril and it's growing from the periphery of the lens, moving centrally. So cortical spoking cataracts are graded in severity on a scale from 1 plus to 3 plus by the area of visual field that the cataract obstructs, and they're typically best graded while visualizing with retroillumination. So a cortical spoking cataract is graded 1 plus if it takes up 1/8 to 1/4 of the total area, 2 plus if it takes up 1/4 to 1/2 of the total area, and 3 plus if it takes up 1/2 or more of the total area. Now, of course, definitive treatment of these cataracts, like any type of cataract, is cataract surgery.